The Hunter Primary Care Psychological Mentoring Program, funded through the Primary Health Network, is part of a suite of capacity building initiatives, which is funded through the Australian Government's response to the National ICE Task Force portfolio.
Here at Hunter Primary Care, we're a psychology-based team, but we use the shared care model with GPs. So we do a lot of work with GPs, and we also work in with mental health and with drug and alcohol services, and we have referral pathways.
These initiatives really aim to improve and increase the clinical knowledge within primary health care providers such as GPs, psychologists, allied health and other clinicians, to be able to respond to and treat and support people presenting with drug and alcohol issues.
We've been a mixture of seeing clients and doing referral and triage and information management, and then also taking part in specific training courses and working with our colleagues to practice our skills and learn more about the therapeutic approaches that really work well with drug and alcohol.
Prior to coming on this placement, there might have been things that I could have overlooked or not seen as part of the presenting problem when we look at it. But then when I do see it or I do hear it now, I tend to question it just a little bit more, just out of some curiosity to see how it fits, if a pattern's going to emerge out of it and how that might relate to some of the stresses in the client's life.
Instead of having that moral judgment on drug and alcohol misuse, you'll see how that fits in with that person's life and how they're using it to help them cope through life. And just by teaching them how they can interact with each other and giving them other coping skills and not shying away from talking about it will make you more effective, and you'll have better treatment outcomes with your clients.
The PHN is committed to ensuring for the improvement of healthcare for people presenting with substance misuse issues, to ensure that people within the community are able to access the right care at the right place at the right time.
Oh look, it's made a difference already. Even just taking the skills back to the work that I've been doing, I ask more questions. I spend some time really understanding what that's like from that client's perspective, and then talking with them about what are their goals around drug and alcohol use. Some of them don't want to make any changes. Sometimes a little bit of psychoeducation around their use and their coexisting mental health conditions can be as much as they want, or they might say I want to stop or I want to reduce, and we can talk that through more often, more intensely, and it just means that they've got an opportunity to have some really good evidence-based strategies specifically for drug and alcohol, as well as their other disorders.
Mental health symptoms are often being self-medicated by alcohol, cannabis and other drugs, that knowing that you can't treat one or the other, they need to be treated in the context of each other.
Part of the placement here is also being exposed to clients that you wouldn't typically pick up as someone that has been using drugs or alcohol to help with parts of their lives. And a lot of them could be high functioning and managing day-to-day life really well, but there's this stressor in the background that's slowly working against them.
Primary health care services are generally accessible for people within the community, whether that be their GP, like local psychology services, what have you. So it's important that the PHN is committed to ensuring that local clinicians feel confident and have the right skills and knowledge to be able to provide quality support and treatment for people with substance misuse issues.
Skills that we get out of here, they're a gap that we don't know is a gap because we weren't exposed to it. Being exposed to the training that we have here and the tools and the skill set that you need to work in this industry makes you aware of that gap. So in saying that, thank you to Hunter Primary Care and to the Primary Health Network for creating this opportunity for us, because that's something that I'll take to my other places of work and future places of work.